Hello, everyone. Thank you for joining in this webchat on COVID-19 in Africa. We're going to talk, of course, about challenges, and this time to be in terms of population, public health, and response strategies developed by many African countries. And it's really my privilege to introduce to today's guest speaker, Mr. Souleymane Coulibaly, health communication specialist, PhD candidate at Queensland University of Technology, and also Fulbright scholar at the Colorado State University. So, as you certainly saw during the advertising, the program it will be a bilingual program. So at times we're gonna go in French. I will certainly have a staff member joining me for the French part. But for now, let me pause here and invite Mr. Coulibaly for his presentation.
All right, thank you, Mr. Arno. Hi, everyone. Thanks for attending this special program about COVID-19. There's a lot one can say about this pandemic, but today let's focus on the global health crisis and its impacts on the population and the kind of responses the governments and the community in Africa are trying to implement in order to counter this virus on the continent. I'm Souleymane Coulibaly. I'm from Côte d'Ivoire, making this presentation from Australia, where I'm conducting research about digital health inclusion. I am also, like Mr. Sumo said, I am a former Fulbright grantee at Colorado State University, 2016 and 2018. I'm a health communication specialist. What I'm making presentation of today is the blended of information that I got from my own experience in public health and health communication, and also through my knowledge and skills that I acquire from different educational institutions. So thank you very much for having me. I would like to pause and thank Mr. Asumu and the US Embassy for putting all this together. Thank you for having me. Thank you for this special opportunity to contribute to the initiatives that people are having around the continent in order to counter this deadly virus. Thank you very much for inviting me. So this is the overview of what I'm going to talk about today. So we're going to give some context, contextual information about how the virus started and then when it started. And we're going to give some information about the transmission modes and how people can deal with the situation. And probably we're talking about Africa here, so it is important to have some information about the distinctiveness of African populations and from the other parts of the world. So we're talking about COVID-19 here. We're talking about virus. We're talking about the deadly disease. So we are in a specific area. This specific area is the health systems. So it is important to discuss, to get some information about the health systems in Africa, how it works, and the different actors that we have in these health systems. So having this information, this background information, will help us understand how public health is trying to handle this pandemic of COVID-19 in the world and in Africa in particular. So we still have some challenges, behavioral challenges, non-behavioral challenges, and then logistical challenges. So it is important to know, to identify those issues very carefully and be able to address them. And with this presentation is also going to give us some opportunity to kind of analyze the kind of responses that the governments in Africa implemented to counter the virus, and not only the government, but the community also, trying to, to do in order to counter the virus. So based on our analysis, I will be able to make some suggestions about how to better deal with the COVID-19. Yes, Africa is doing good, is doing great when you compare the numbers in Africa to the other part of the world. But specialists and epidemiologists are warning against, becoming too much enthusiastic about the numbers, the figures in Africa, because the next epicenter could be Africa. So we need to be very careful. We need to be focused in order to prepare for the response that we want for our continent. So like I said, so we're going to start with some background information, some contextual information. So this virus started in China, in the province of Hubei in Wuhan, related to a seafood market. And it was in late December 2019. And then it spread it a little bit further. And today, the whole world is infected, is affected by the virus. And then, so when you talk about COVID-19 here, it's important to know exactly the kind of transmission modes that people can get. We talk about an infected person who coughs, who sneezes, who exhales. Or this way, people who are very close to this person, because of the droplets of this infected person, you can catch the COVID-19, can catch COVID-19. So this is important to know, because knowing that this specific transmission mode, it is critical to understand that it is important to implement some kind of preventive measures, some kind of protective measures that are very, very critical in order to protect our populations. So let's give some timelines about how an outbreak becomes a pandemic, how a virus, an infection that started in Wuhan in China has become today a global health crisis. So we have some key times, some key dates here. Okay, on December on the 31st of December 2019, everything started with an infection. The Chinese government informed the WHO that there was an infection that has started, infecting population in China. And then on the 5th of January 2020, the WHO stated that COVID-19 has become a outbreak. And then on January the 13th, 2020, we have the first case outside China, and this first case was in Thailand. Okay, and for Africa, the 14th of February 2020, we had a case in Egypt, a traveler coming from Asian countries who has been there for some weeks, started showing some symptoms of COVID-19. And then on the 11th of March 2020, the WHO classified COVID-19 as a global pandemic, as a pandemic. So you see that in a very short time, we started from a virus, people call it like flu, people call it like an infection, and then it has become, today it has become a very, very serious disease. So in a very short time, it developed from an outbreak to a pandemic. Okay, let's see some figures of how important this pandemic has become for the world. So up to 10th of July 2020, we have more than 12 million confirmed cases of COVID-19. Fortunately, 5 million of them recovered. Unfortunately, we have more than 500,000 people who passed away because of COVID-19. From my knowledge, not a single country has reported without having no cases, okay? We heard about North Korea, we heard about some island countries who are very, very, remote from continental, okay? No plane, no flight, no regular flight, no traffic. But we are not sure that there's no case in those countries. So we are more than 7 billion people in the world. Half of us could be infected by the virus. And unfortunately, we may have some massive deaths due to COVID-19. And what is becoming problematic is not only about health issues, it has become an economic issue too. Nearly half of people in the global labor force could lose their jobs. It has already started in Africa, in North America, in Europe, in Australia, where I live right now. So we have many, many people who are losing their jobs. And in that, we have more than 1 billion people who work in the informal economy who could lose their income sources. And unfortunately, our economy in Africa is mostly based in the informal economy. So we need to consider this in order to make sure that we are getting a very good response in order to deal with the situation. So the impact on Africa continent is the same too. We still have people who are losing their life. We have people who are losing their jobs. We have people who are really, really struggling. They are losing their houses, they are losing what they have, and then it becoming problematic. So it is the same phenomenon that we observe around the world that we observed in Africa, even worse. So before going further, we need to have, to agree on the characteristics of the African population. So we're going to give some detail about the demography, health status, and socioeconomic factors, because Africa is really distinctive compared to other parts of the world. The total number of the population in Africa is more than 1 billion people. And then the population density is very interesting too. In East Africa, you have countries who have very, very dense population. Or we might talk about Ethiopia, more than, let's say 100 million people. In Tanzania, more than 59 million people. Kenya, even 53 million people. Uganda, 45 million people. So these are big countries who are really, really populated. So there is a density of population there compared to Western Sahara and Southern Africa. Southern Africa, when you put aside South Africa, Botswana, Lesotho, Swaziland, Namibia, these are countries who have less than 2 million people, 2 million people, 2 million people. When you take, for example, Lagos and Abidjan, and I don't know what you call Kinshasa, all these countries have more than 3, 4 million, 5 million people, okay? So it is important to know that. What is distinctive with the African continent is the population that is younger. When you compare it to the other continent, to the other parts of the world, we have a younger population in Africa. So let's talk about health status. We notice that the life expectancy in Africa has increased. It is very, very interesting. This is very good news. So we have 61 years for life expectancy in Sub-Saharan Africa. But compared to the other parts of the world, this is the lowest. This is the lowest. In Europe, we have more than 80 years of life expectancy. North America, 79 years of life expectancy. And probably in Asia, which are a little bit closer to us, 70 years for life expectancy. So life expectancy in Africa is the lowest compared to other parts of the world. And when we talk about health status in Africa, we still have some persisting communicable diseases, malaria, HIV/AIDS, tuberculosis, and non-communicable diseases, hypertension, diabetes, and different type of cancers. And we do have violence too, due to war, terrorism, etc., etc. So we have some health issues in Africa. And it is related to the factors. The factors are the more familiar factors that we have: alcohol abuse, cigarette abuse, lack of physical activities. And then we have the diet issues. Because of, life is becoming modern in Africa, there is a change in our diet. Many people are eating not our traditional food that we used to, but we are eating food with a lot of oil, things, fat, etc., etc. So there's a change in our diet. So we have diet issues. And then, unfortunately, we do have some problem of lack of, vitamin A, lack of iron. So all those things are related together. So it makes our health status a little bit lower when we compare it to other parts of the world. Now let's talk about the socio-economic factors in Africa. For education, for example, Africa has the lowest literacy, 65 literacy, when we compare to other parts of the world. Unemployment is a very big problem. I talk about the population that is younger, but we still, this is one of the continents, at least the continent which is unemployed, which has a problem of wages, underemployment, okay? So it is problematic. The more problematic information that I can send is, I can share with you is, like many families in Africa live with less than $2. It's like 1,000 francs CFA, less than 1,000 francs CFA to live with a family, 5 members, 6 members, 10 members. It's very, very tricky. So this is the information we need to get to try to understand why COVID-19 is becoming a serious illness, and we need to be very, very careful. So we're talking about a health issue here. So it is important to know the area where we are sitting right now. We're talking about health, we're talking about health systems. So talking about health systems, it means that we have different components. We have different sections in the health that are combined together, that are interdependent, okay, in order to make sure that everything works perfectly. So the health system is the combination of resources, organization, financing, and management. So everything put together in order to deliver healthcare to the population. So based on the analysis on the framework of the WHO, we have some system building blocks. Those building blocks are important, like input for human resources, input for money, input for material, etc., training, knowledge, etc., in order to deliver services, for our health system to become responsive, for our system to improve in efficiency, for our system to kind of mitigate the poverty due to health status. So it is important. So the WHO is talking about building blocks here, because if only one block is not functioning, is not working very well, then the whole system could collapse. You might see here in this photo, a typical hospital ward in Western Africa. You can see some patients, on the ground with their parents on the ground, an overcrowded room filled with, health workers and the patient and parents. This is not the standard that we would like to have in our hospitals. So this is typical of African hospitals. So we need to have that in mind. So when we talk about health system, we also talk about the persons, the stakeholders, people who are very involved, and organizations who are very involved in it, and how it works. So when you talk about health systems and the main actors, people think about public health sectors, private health sectors, like public hospital, private hospital, and we try to ignore the traditional healers, the traditional medicine. So it is important to put that, because you need to know exactly where people get their health services. It is not what you want people to do, but where people get their health services. And yes, many people go to public hospital, they go to private hospital, but many of us go to see the herbal healers, the traditional healers, to get some plants, some herbs in order to cure a disease. So we have insurance companies, pharmacies, the NGOs, international organizations, which support the government in order to implement some medical healthcare policies. So these are some actors that we have. And of course, it starts in our household, in our families, because we do have some drugs in the cabinet. When a kid has diarrhea, they can provide some syrup to this kid. They can provide malaria tablet for this kid. So health actors are various, and it is important to consider everyone when we want to address health situations. So how it works? So the health system works because we have some input. We talk about financing, on how do we make money to support the system? How do we allocate the funding from the government, from the donors? It is important to know that. And also we have the management resources. How do we train health workers? The technology, do we use technology in order to advance healthcare? And we have how the services is delivered, inpatient care, outpatient care, public health. And oversight, the government play a key role in the health system because they are the one who are the policy makers. They use regulation, they use strategic partnership with donors, with technical partners, and incentives. It is important to motivate the workers. How do you motivate them? Salaries, the basic one. If you want them to avoid some, negative behaviors that we all, very, very critical of, it is important to make sure that they have the right incentives in order to motivate them. So all these put together, we're going to have a very good result. And the result depends on the input. So health status depend on everything I've just mentioned here. And it is important to avoid that a family member use is the majority, the large part of his salary to put in his health. This is why universal care is very important. I know it is very difficult in Africa with different governments who are trying to implement universal care, but it's important to do that. We should avoid that a father will use more than half of his salary to cure a non-communicable disease, diabetes or hypertension or cancer, etc. So this is why we need to have a system in order to make everybody get access to healthcare. And the patients are the one who will tell you if they are satisfied with the healthcare they receive or not. So it is important to ask them if they are satisfied. If they are not satisfied, they're going to give you some information. So this is how health systems in Africa works. So it's important to be aware of all these actors, not only the official one like public hospital and private hospital. We need to be careful with all these actors and develop the sectors, train people, provide some oversight in order to make sure that everything is going like we desired. So talking about health systems, we're going to mention like two parts. So we have public health, we have medicine. Regarding COVID-19, we have medicine. Medicine is like where people receive the treatment, medical care, in the hospital, related to the hospital, etc. And we have a section that is based on the population, which is public health. There, it is important to go to the roots of the problem. What causes people to become ill of diabetes? What causes people to become ill with hypertension? What causes people to have HIV/AIDS? It is important to go to the community. It is important to go to the population in order to educate them, in order to understand the behaviors, the reason why people have some risky behaviors. So this part is very important to differentiate. So there is a difference between public health and medicine, even if both sections are in the healthcare systems. So the community plays an important role in public health. We're talking about NGOs here. We have wonderful NGOs in Africa who do wonderful jobs on the ground. These are people who work with the communities, and they are playing a key role in battling COVID-19. So when we come to COVID-19, how it is handled by public health, I'm going to give you just some few elements here. Public health seeks to understand how the disease spreads. It started in China. Today, it gets to China first. It started in China. It went to Europe, to America, and now it is getting spread in Africa. It started with the capital cities like Dhaka, Abidjan, Lagos, Rwanda, and Nairobi, the big city capitals, and it is spreading from the city capitals to the rural areas in Africa. So it is important to have some scientific knowledge of how the disease developed. And the public health provide guidance and advice. So what I'm saying today is based on the guidance and advice from public health. It also support people in isolation, okay? You say people, if they are infected, please stay at home. But how do you make sure that they stay at home and they have, you meet the needs? They need foods, they should avoid going to the shop, buy food, etc. So we should have some mechanism in order to go there and meet them, provide food for them, and give them the necessary thing that they need. So public health does that too. Specifically, the responses of public health in COVID-19 is organized very well. So we have disease surveillance. It is important to detect the number of people who are infected by the virus within the community. So disease surveillance is important. We can do it traditionally, like through community health workers. We can do it by technology too. Okay, so public health also do the contact tracing. When someone is infected, how many people this person was with other people who can be infected by this person. So it is important to get those people and make sure that they don't have a disease. So contact tracing is very, very important in COVID-19. And hopefully a vaccine will become will come soon. So when the vaccine is here, we're going to use public health in order to administer vaccinations and drugs to the population. And we are obliged to manage mass fatalities. Even in Australia here, you might heard about Melbourne, like a big neighborhood can be quarantined, okay, lockdown for a part of the city, and make sure that people are not getting in, are not getting out. So it is important to put some barriers and make sure that those people who are inside those barriers have, meet the needs, the food and water, everything they need, and make sure that people who are outside not getting in. So this way we can manage mass fatalities, more deaths. And what is important with public health is like we are documenting all the information we have right now and make sure that we prepare for the next waves, the next emergency, okay? So this is what public health does right now. Now, let's see how our government in Africa responded to COVID-19. It started in Asia and then went to Europe, America, and then in Africa. We noticed that our government learned from the other part of the world. They learned from Asia, they learned from Europe. But unfortunately, what we observed is that they kind of apply the measures that have been working in other parts of the world and kind of without contextualizing, without facilitating conditions, they apply the measures in in Africa. Okay, so you can see on your here you can see total lockdown of streets are empty, shops are empty, markets are empty here. This is the consequence of total lockdown, okay, of public spaces, okay. So yes, it is problematic because we have our local situations. People need to go out on a daily basis to get their income. How can they survive if there is total lockdown? So yes, the government also trying to comply with the WHO too, because they warn the population, they provide guidance to the population, to the government, do this. But we need to contextualize the measures in order to make sure that, okay, we address the infection problem, but also we address social and economic problems too. Now let's see the impacts of those measures due to COVID-19 on population. Due to lockdown, due to productive measures, etc., we have many people who struggle who lose their job and their income sources. And prices are rising on the market. Our mothers and our wives find it very difficult to buy food on the market because of the perturbation in the traffic. A truck cannot leave a spot A and go to a spot B because of a lockdown. We have night curfew from 7 p.m. to 5 a.m. Generally, those trucks working, traveling during the night. So there was night curfew. So this is a little bit difficult. And we have some law enforcement abuses in tension too. Or you have in region like Togo, in other parts of the world, that the police, the security forces, brutalizes the population to make them comply with the restrictive measures. Okay, and then there were some tensions because people, people started starving. They don't have food enough. These are people who don't have savings because this virus, took everybody by surprise. When you don't have enough savings, when you don't have enough foods in your house, then you need to go out in order to work, find some money, and put food on the table for your families. So there were some tensions, and we observed some police brutality because people are not complying with the different measures. And then we have, unfortunately, within the couple, gender-based violence. Women suffered a lot. People have some struggle because they have some tension. Some of them lose their jobs, and women. It was reported that many women suffer from gender-based violence within the couple. Unfortunately, we have some mental health issues because people are worried about the future. There is an uncertainty for the future, losing their jobs, etc. So we have an increase of mental health issues in Africa. And insecurity. You might have heard about the looting in South Africa. People will go and loot some shops and take things because of insecurity, and people will break the shops and steal everything in the shops, etc. Unfortunately, because many women work in the informal economy, hairdresser, sellers in the market, sellers in the shops, in the restaurant, many women works in that area. Unfortunately, they are losing their jobs, so they don't have money. So prostitution, unfortunately, is rising too. So these are the how COVID-19 impacts our populations. So talking about the measures, protective measures and testing, you see here, we have some example here, basic hygienic measures, washing hands, hand sanitizer, face masks, and social distancing at the market. A wonderful picture here seeing our mothers social distancing in a local market in Africa. And then you also see these health workers who's preparing to get a patient testing. You can observe that she's not working in an ideal situation, sitting literally on the table in order to do this critical test for this patient that is just in front of her. So when people can, they practice, they implement the protective measures. But when they cannot, it's kind of tricky. So it's important. So we have all those measures that are implemented by the government that the population trying to follow. So this is the government. And then we talk about here the community, how community responded to COVID-19. We talk about community resilience here. This is not the first crisis that we observe, we experience in Africa. We have Ebola, we have HIV/AIDS, and generally community population of some initiatives in order to deal with the situation. So it is a very good spirit that the community becomes strong and trying to face the situation. And this is a very positive spirit too. So this is some example of how communities in Africa responded to COVID-19. So you have some health messages that are broadcasted on community radios in local languages. And you have involvement of public figures and celebrities. I have the example of Didier Drogba with some partners who will, give some, some food, food kits and some material to some vulnerable population. We have the involvement of community leaders, traditional leaders, community leaders, and traditional communicators in order to pass on the message and to inform the population that there is a virus and people should be protected and protecting their families too. And we have a wonderful community solidarity, and with people, young people, creating some, some tools like ventilators. We observed that in Somalia, a young man invented a ventilator made by his hand, and that was amazing. And he received a lot of encouragement by stakeholders and the government too. And we have artists too, those who are very good at editing videos, like Allo Allo in Senegal. We have people who are very good at technology, like making some app. In Kenya, for example, we have contact tracing apps. So when people is infected, when a person is infected with COVID-19, this app can help, kind of identify other people who shared like a location, who this person who is infected is being with. So, and we have some artists, very good singers, and we have wonderful messages that we hear from those wonderful songs in order to use the local resources that we use in order to, to counter the virus with different initiatives by the community, positive spirit, wonderful spirit in order to battle against the virus. So yes, we have all those initiatives by the government, the measures by the government and initiative by the community, but we still have some challenges, behavioral and non-behavioral challenges that we need to identify and make sure that we can address them. So from individuals to states, we have a problem of information. People just think that, first of all, the disease was like a disease for rich people. Yeah, for sure. And it started in the bigger cities, and then it is getting to the rural areas, but this is not a disease for rich people. And people don't comply with the protective measures. You can see on this photo that this young man is the only one wearing a face mask compared to 12 other people around. So this is typical, okay? I know that some people are very cautious. They will wear their mask, but many people in a place like a market, many people are not wearing the mask, and that is something that is we need to fix. And then we have our people who have some, diabetes, hypertension, HIV/AIDS in Africa. This is a burden. And these are typically the persons who are vulnerable to the disease, to COVID-19. So make sure that those people who are very vulnerable, to make sure that they are protected. So it is important. And we still have people who fears and stigma discrimination. Not many people will inform the population that they have COVID-19 because they fear stigma, they fear discriminations. It's like exactly like the case that we had with HIV/AIDS, where people were hiding the cases, they were hiding that they were infected. Unfortunately, that way, they will be infecting many other people. So fears, stigma, and discrimination, make people hide the disease to the network, their families, and people in the work setting. So we still have people, we are in Africa, we have low-income population, and then we have population movement too. When the virus started, you might have seen that many families were fleeing Europe to come to Africa in the flight during the pandemic, after the pandemic. So many of them were fleeing Europe when Europe was hit by the virus, okay? And even in Africa, some people will try to leave the capital city, big cities, and go to their villages in rural areas. So this was also a very big risk for local populations. And so we saw some movement of population due to COVID-19. And we have social and gender inequalities. Rich people have better access to healthcare they get better testing, they get better healthcare to treat for treatment, and poor people struggle, okay? And even in that, we have gender inequalities, you know, many women lose their jobs. Like I said, they are the one who works, the majority of them works in the market. They are sellers, they are hairdressers, they work in local restaurants, etc. And then all those shops are closed. At the beginning of the crisis, all those shops were closed, so it became very difficult for women. As you know, many women are, you know, the income, they're the one who will bring money and put food on the table for their families. So we have these social and gender inequalities. Another challenge that we notice are vulnerability of frontline workers, nurses, doctors, those people, ambulance crews, those people who are the front line of the battle are very vulnerable. Many of them died, okay? And then they are concerned, they have mental health issues because they are afraid not only of the dangerosity of the disease, but for the families too. They don't want to infect like the children and the husbands or their wives, etc. So it is important to address frontline workers, what they need, the material that they need to protect themselves and protect their families should be provided to them. Unfortunately, we have another challenge that is in Africa, armed conflicts. And we have terrorist attacks, we have, you know, all those violence, you know, armed wars, armed conflicts. So we have internally displaced people, refugees in Africa. These are people who are already vulnerable. And in this context of COVID-19, so it has become, the situation has become worse, okay, because of conflict, okay? So we have the case of refugees and internally displaced people in Mali, in Burkina Faso, in Senegal, in Nigeria, in Cameroon, in Chad. Those people are displaced because of conflict in Africa. And we have a problem of findings. Many governments are calling for help, like international help. Unfortunately, everybody is struggling financially. So, and when we don't have enough funding, so we have some shortage for logistics to provide material for hospitals and treatment centers, etc., etc. And we have insufficient capacity for testing too, okay? Governments are trying to make their effort, but it is very difficult. When compared with the needs for the population for testing, what we have now is very insufficient. And another challenge is our borders. The borders are very weak, okay? Some weeks ago, we heard that some people from Burkina Faso have been stopped in Côte d'Ivoire because they crossed the borders and while the borders were supposedly closed. And I think Burkina Faso stopped some people coming from Côte d'Ivoire. And so our borders are very weak. And then it's, to be effective, we need to have like very good oversight, you know, law enforcement in order to make sure that our borders are very strong enough to comply with the protective measures. So based on our analysis, we're going to make a suggestion about how to respond, to better respond to the COVID-19 and curb massive deaths. Okay, we observe that this global health crisis is more than a health crisis. It has become a humanitarian crisis. When people are losing their jobs, when they are losing their houses because they don't have money to rent house, when they cannot pay the bills, etc. So it has become a disaster, not only a health disaster, but it has become an economic disaster. So it is important to make sure that we take into account those different aspects and put all this together in order to implement a strategy that addresses all those issues. So what we're going to do, our response is going to try to reduce the risk and vulnerabilities of the population and increase the capacity to deal with the consequences of COVID-19. These are the objectives that we would like to try to implement and to achieve. So it is important in our strategy, a multi-sectoral strategy, it is important to make an initial health assessment. So the number of cases, those who recovered, the age categories of those people, the health needs, the food needs, shelter needs, etc. And get all this information so that we understand the importance of a disease and how people react in local communities. So we're going to reduce risk factors too, because this problem is an hygienic problem. So we need to make sure that we promote healthy and hygienic behavior so that people wear systematic face masks. It's like the protective condoms. When we were battling against HIV/AIDS, people were taught how to use condoms. So we're going to do the same thing, that wearing masks, it must be something systematic. We shouldn't joke with that. So we should reduce risk factors. And then we need to focus on the vulnerability of the population. So we mentioned that people are losing their jobs. So we need to make sure that they have the minimum that they need in terms of food, in terms of health insurance. We talk about universal care that government are trying to implement, but we still have some challenges there. We're trying to make sure that people are not losing their jobs, and trying to make sure that people who have diabetes, hypertension, cancer, HIV/AIDS, and refugees, internally displaced people because of violence, those people are the most vulnerable, that they really need to be protected. And we need to increase community to cope with the situation. We have our local resources, we have our local talents, we have our local experiences. We just seen some talented artists that we shown here. We have some experiences too. We've been battling HIV/AIDS and Ebola. So we have some experiences of outbreak, how to manage outbreak. So we need to rely on those resources and experiences and make sure that we can, curb massive deaths based on our local capacity. And it's a disaster. Not a single community alone can fight against this disaster. Even developed countries are struggling regarding COVID-19. So we shouldn't be ashamed to call for help, like technical support, and to build our capacity to train people, healthcare workers, everybody, and make sure that they have the equipment, they have the training, the necessary training to battle the disease. And then it is important to talk about monitoring and evaluation. So it is important to make sure that the activities that we're trying to do is implemented in the right way and achieve the result that we want. So to start, it is important to collect baseline data, the affected population, the number of cases, number of recovery, number of people who, the age categories, etc. Get this information, and then implement the strategy. And when we implement the strategy, we make sure that we have very good indicators of the success of the strategy. And since we have baseline data, we have initial information. When we implement the strategy, we'll make sure that it is our strategy that is making difference in people's life, not waiting, not just measuring the number of activities, the number of radio sport, the number of training, etc. So we want to see change in people's life. So the better way to do that is to set up some rules, many rules, to check governance, to check accountability, to make sure that everybody is playing his role at his level. And so M&E is very important too. So as I said, the strategy is based on the emergency, the humanitarian emergency, and the health emergency. So our framework of this response that we suggest will be combined on sphere projects and behavior change communication. So SPHERE project is a critical document by key humanitarian agencies, Médecins Sans Frontières, Oxfam, and then Cross Credentials, and all those big agencies that sit down in order to make sure that they have some rules and provide quality services to affected population by disasters. So quality and accountability was in their mind when they organized this critical document. And they were following people's right to life. It is important, even if they're suffering from a disaster, it is important to protect their life, their right to life. And this document was very critical in order to alleviate people's suffering. they suffer from disaster, they suffer from conflict. So it is important to make everything sure that, to do everything so that people have the minimum that they want. So they identify minimum standards for people. They should have water, sanitation, and hygiene. They should have the minimum food, 1 person per day. They should have a minimum shelter to protect them against the environment, insecurity, and diseases, and make sure that those people in this challenging time have the healthcare they need, even if they don't have money. So the Sphere project is very, very important because the response that we want has a humanitarian aspect. The global health crisis has become a disaster, economic disaster, and a health disaster. But not only that, the other section of our response is based on the behavior change communication strategy, also called social behavior change communication. So the design should be something participatory with communities. We should have some representatives of the community and be able to sit down and identify our local forces and strengths and strategies and talents, and make sure that we have locally resonating, locally relevant responses that we desire. And then another rule of thumb is the health message that should be consistent. And behavior change communication is not only passing information to people in a passive way. It should be something active. And we should train people to have the skills necessary. Wearing face masks, social distancing, we should teach people how to do that actively, not sitting down and teach people how to do it. We should train them. This is why it should be something we should improve their skills to do that. And we have an experience on that. This experience comes from our battle against HIV/AIDS, how people use the condoms. We were in the market in order to teach people how to use condoms, etc. So it is important not only to pass on the messages, but it is important to sit down to teach people, to train them the skills they need in order to behave the way you want. And all those messages and training will be provided using different types of communication strategy. Interpersonal communication, community health workers will go to the families, teach them how to do things, inform them, exchange material, discussion, etc. That's very important. So community health workers with individuals, with families, visiting them in the families, and make sure that they understand the situation. And we're going to use traditional media too. We have newspaper, traditional communicators, we have radio, etc. that will broadcast health information, sports, etc. and make sure that people could understand, even if they don't speak English, they don't speak French, in local languages. So use those traditional media that old people like so much, okay? And then beside traditional media, we have digital media too. Today we're talking about internet. And we have very talented people who can make very good technological tools and make sure that young people who are using internet a lot can access material and their preference and the messages that they want and using the modalities that they want. So apps and devices, mobile phone, etc. So we use all those different types of communication with the same message, consistent messages, and trying to teach people how to behave exactly. I think that will be interesting to deal with the situation. So humanitarian aspect, public health aspect combined together to give the response that we want. Otherwise, we will provide some responses that deal with health, and we will not provide responses that are not doing with a humanitarian aspect, and that will be difficult because people are losing their jobs, they are losing their renting, they are losing their houses. So based on this, we're going to give some graphic here. We're going to use a graphic in order to show what we think is interesting here. So we have different aspects that are important in our response framework. The water sanitation, like I said, the Sphere project mentioned water sanitation. A person, for example, needs 15 liters of water per day per person. Food, we need to have kilocalorie, okay, 2,000. Shelter and adequate housing for the person, because if they are outside, if a whole family is living in the street, how can you prevent COVID-19? So we need to make sure that people are not losing their houses and provide housing for them. And make sure that for this period of crisis, at least we're going to give like free care for every family that really needs it. So these are the minimum standards, humanitarian reflection, humanitarian response that the Sphere project provides to the community. So based on that, we're going to focus on the specific area of health here. So health is our focus today, so we're going to discuss that further a little bit. So we are almost at the end of the presentation. So we're going to focus on health here. In health care, we have two sections. We have health care that treat diseases and health issues, including COVID-19, as an integrated strategy with special protective measures. Okay, so for treatment, healthcare. But let's focus on public health here. So in public health, we're going to have two strategies here: preventive measures and interventions. So within preventive measures, it is important to identify the risk factors and try to address those risk factors. Why people behave the way they behave, okay? And we should not only pass on messages, but we should teach them how to do that. And we have experiences in that too. And we need to address vulnerability of the population. Because when people don't have clean water, I talked about the displaced people, the refugees, and people who are living in slums, people who don't have water, regular water. How are they going to practice good hygiene, washing hands, hand sanitizing, if they cannot, they don't have the water, they don't have sanitation that is necessary to implement, to practice those basic hygienic gestures. So it is also important to improve access to food and health services by using those communication strategies that I mentioned earlier: interpersonal communication within community health workers and families, within community health workers and persons, etc. Using traditional media, digital, community mobilization, getting to see, invite, go to visit the traditional health workers, the community leaders, the religious leaders, and involve them in mobilizing the community in order to make them aware of the situation. The situation is very serious, so we need all those stakeholders, traditional, administrative, political, all the stakeholders, people who are very influential, in order to mobilize their communities to advance, to promote healthy gestures, healthy behaviors, and make sure that everybody is behaving the way we want. And then we have interventions. Interventions are conducted by trained community health workers. Trained community health workers are the one we're going to use in order to detect people who are infected in communities, okay? The information is that when you are feeling some symptoms, you need to stay at home and call for help. You call the healthcare systems and make sure that they will come to your place and make sure that everybody is tested, et cetera, et cetera. So the people who can do that are trained community health workers who are going to the community and detect and identify new cases and make sure that they document information so that we have a very good surveillance system. And biological manifestations, they are the one who can check if it is COVID-19 related, or if it is malaria, or if it is other viruses. So they play an important role so that everybody, is not only receive the health messages they need, but also they are in the community and make sure that they identify new cases of COVID-19 and report to the hierarchy, to the health district, in order to make sure that the local government is organizing the response in a very best way that people really need. So I am at the end of this presentation. We'll be very happy to listen to you all, to your question and your comment. And these are the sources that I've been using to make my presentation. I will leave you with some messages, some COVID-19 messages that are very, very important. All those messages, we can translate them in local languages. They should be consistent and they should be in different format so that young people can use them on the internet and old people can access them in the traditional media, etc. Stay safe, practice social distancing, Protect others by wearing a face mask. Wash your hands with soap. Clean your hands with hand sanitizer. Avoid touching your eyes, nose, and mouth. Stay at home or self-isolate when you feel sick and call for help. Thank you very much. I'm waiting for your questions, and I'm very, very grateful that you stay until the end of this presentation. Thank you very much.
All right, thank you so much, Mr. Souleymane Coulibaly, for this very informative and insightful presentation. I think now we're going to turn to the second part of this program. I think we have like about 10 or 15 minutes left. So it will be the opportunity for maybe participants who may like to add additional information, maybe add some comments, or also maybe ask questions. I can see Dr. Kipre. Maybe wanted to add something. So Dr. Kipre, please.
Thank you very much, Mr. Asumu, for this platform that we were offered to listen to Dr. Coulibaly, who I'm really grateful of, because it was a great presentation, and once again thank him for his presentation. It's a brilliant presentation and very informative. So now let's go to my question about challenges. It's not a question, but maybe a contribution. Like the challenges in this COVID-19 management, we had the community role. Concerning the community role, you know, this COVID-19 spread out in African countries because of the role that the community had not played at the beginning of this crisis. And if you go to some of the communities which are religion-based, you know, due to some of the beliefs, people didn't want to stay away from their mosque or their how do you call it, their parishes. So it triggers this contamination and the disease spread out. And another challenge in this COVID-19 management is corruption. You know, corruption. Why corruption? Corruption because when you go to the administration today, the government had made efforts to encourage those workers who are at the front line, like medical officials or medical professionals, and they have been granted some subsidies, some funding from government, and this money is being hijacked or snapped by some of the people in the administration. It's not encouraging for people who are working at the front line. And the second issue about the corruption is among the security forces. You know, as for our country, at the beginning of the crisis, you know, the economic capital, Abidjan, was cut off the rest of the country. And some of the people, then they were bribing security forces to trespass this rule. You know, so from these perspectives, I would like you, if you wish, to add as challenges in Africa in this COVID-19 management issue, community role and corruption. And my second question is the feasibility of this universal care insurance in low-income countries. Is it feasible? Is it feasible? Thank you very much.
All right, thank you so much, Dr. Kipre. So, Dr. Coulibaly.
Yeah, so thank you very much, Dr. Kipre, for your contribution. Yes, is it feasible? I think we have very wonderful way to express solidarity in Africa. We shouldn't rely on external support. I know this is a humanitarian crisis because, you know, even developed countries are are facing challenges too. They're struggling right now. So rely on external support will be very difficult. But I mentioned like two aspects in my response, like emergency, humanitarian aspect, food, shelter, water, and then we have the health challenges, behavior challenges. For our food, for example, we have our, women who are very active in agriculture, who can, provide some, support the government. We need to address the corruption that you mentioned here. But in Africa, we used to share food. We used to share one yam here. We used to share banana here. When you know that, when you need that, you know that someone is having serious problem and they are starving. So we have this solidarity that we can use, relying on those association of women in vegetables and fruits and etc., and make sure that the government support them in order to communicate this solidarity to other members. It can be enough in the neighborhood. I know everybody is impacted, but we can find new ways. We can find innovative ways in order to deal with the situation. And for sure, if we fight against corruption that you mentioned here, I'm sure that the finances, this is why I talked about governance and I talked about accountability. Because without rules, without M&E, without oversight from the government, then it will be very difficult to kind of see clearly who did not do his job or her job. That when the rules are very clear and there is transparency in the whole system, we can easily identify who didn't do his job or who is corrupted in the system. So we need to do that, but we need to express our solidarity in the African ways. And I'm very, I know that we have some women on the ground who are working in the area of agriculture, food, etc., etc. And then we have social affairs related to the Ministry of Social Affairs, who can, provide some incentives, some loans to families who are on the edge of being, ejected from their houses, to support them to rent their houses, etc., etc. So, and then the government will call for external fund, donors, okay? If they provide this fund, that's okay. But this system that I'm trying to advocate for can be locally implemented based on our forces. If we sit down in a very participative way, we try to identify these are the problems, this is what we have as resources, this is what we can do. I'm pretty sure that we can at least practice the solidarity so that we can pass on the other side of this global health pandemic. Yeah, so thank you. This is a discussion that we can continue, but it is something that we can do on our level, locally, the government, and make sure that the fundings that we have are used in the proper way and make people accountable. Make sure that there is, make sure that we have what you call good governance of the findings that will be allocated for this program.
Okay, thank you so much, Dr. Coulibaly. I believe we have one question this time in French. So, Mr. Coulibaly, remember, we promised to be bilingual, so. Ok, donc comme je disais, il y a une des participantes qui voudrait poser sa question, mais cette fois-ci, ça sera en français. Donc, nous allons donner la possibilité de le faire. Donc, je crois que c'est Cécile. Oui, allez-y.
Ouais, son micro est fermé, je crois. Hein?
Ah, ok. Je crois que vous devez activer votre micro, si vous m'entendez. Je vais lui envoyer un message. Activez votre micro. C'est bon? Je pense que ça passe maintenant. Ok, allez-y. C'est bon? Ça passe? Je pense qu'on vous entend.
Vous m'entendez? Allô?
Oui, oui, oui,
Bonjour, docteur.
Oui, bonjour, madame, bonjour. Je crois qu'on l'a perdu, hein? Je crois qu'on l'a perdu. Assoumou?
Oui. Allô?
Yeah, oui, 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 je vous entends maintenant.
Ok. Bonjour, docteur.
Oui,
Coulibaly.
bonjour, madame. Bonjour, madame.
Moi, c'est Kwadjab Sata Cécile, American Kone Yamsoko.
OK.
Ma question, c'est savoir l'impact de la COVID-19 sur les couches sociales les plus faibles. Je voulais savoir des propositions de pistes d'action par rapport aux ONG, les personnes, des entreprises. En fait, je voulais un peu avoir des informations pour voir comment on peut aider ces couches sociales les plus faibles qui sont atteintes par le COVID-19.
Oui, ça, c'est une excellente question. Merci beaucoup, Cécile. Oui, effectivement, notre présentation aujourd'hui est axée sur les populations les plus défavorisées. Et il faut dire que, bon, d'abord, nous avons des problèmes puisque les marchés ont été fermés un temps et puisque les activités ne tournent pas sérieusement. Alors, l'idéal serait que le gouvernement puisse apporter de l'aide financière à toutes ces familles-là, définir un mécanisme qui puisse donner un peu d'argent pour pouvoir payer le loyer, un mécanisme pour donner un peu d'argent pour pouvoir payer les factures, payer un peu l'eau, etc., et à manger, etc., et faire en sorte que, effectivement, cet argent-là arrive à la famille qui est touchée par la pandémie. Mais les gouvernements eux-mêmes ont des soucis financiers aujourd'hui. Et donc, ce n'est pas évident que nous puissions avoir, si nous attendons, nous puissions avoir l'aide que nous pouvons avoir du gouvernement. Et donc, ce que je préconise, c'est que c'est vrai que la maladie, elle est réelle. Et nous avons nos forces au niveau de nos communautés. Et ce n'est pas la première pandémie. Hein. C'est vrai que nous n'avons pas eu, pour la Côte d'Ivoire, nous n'avons pas eu Ebola, mais on a organisé quand même la riposte contre Ebola. Vraiment, au niveau de la frontière, les gens étaient prêts. Et bon, on attendait. Mais nous avons le VIH-Sida avec une très belle expérience de la Côte d'Ivoire, avec l'implication des ONG. Et ce qu'il faut faire, c'est que voilà, il faut chercher des financements au niveau des partenaires extérieurs. Je pense qu'il y a pas mal de financements actuellement parce que c'est une bataille mondiale. Et donc, les donateurs et en tout cas, les agents techniques, là, ils sont très, je veux dire, ils souhaiteraient vraiment soutenir des initiatives locales qui vont dans le sens d'enrichir les populations et faire en sorte que tout le monde puisse faire face à la pandémie. Et donc, écrire, il faut être à l'écoute sur le plan international, sur le plan national, vérifier qu'il y a des projets qui sont lancés dans le cadre du COVID-19, pouvoir avoir des financements et puis supporter les populations. Quand je veux dire apporter un soutien aux populations, c'est pouvoir entraîner les gens, entraîner les représentants de ces populations-là, leur montrer comment est-ce qu'il faut porter le masque, leur montrer pourquoi c'est important de faire le social distancing, leur montrer pourquoi est-ce que c'est important de se laver les mains, etc. etc. Et ça et ce n'est pas, c'est le changement de comportement. Il faut être actif, il faut venir avec des seaux, leur montrer comment il faut le faire, etc. Et ça, c'est des ONG, c'est des organisations, des initiatives locales qui peuvent implémenter au niveau de ces régions-là, au niveau de ces populations défavorisées dont vous avez fait cas. Et donc, au niveau local, nous avons déjà des jeunes qui travaillent sur le terrain. C'est vrai qu'il y avait beaucoup qui étaient dans le paludisme, beaucoup qui étaient dans le VIH-Sida, la malnutrition, etc., soutenus par d'autres partenaires extérieurs. Mais nous nous basons sur ces expériences-là que nous avons, les mécanismes que nous avons, pour pouvoir nous organiser à notre niveau et puis pour pouvoir faire face. J'ai parlé de la nourriture parce que les prix sont un peu sur le marché et nous avons au niveau de, comment on appelle ça, de l'Afrique, cette manière d'exprimer sa solidarité, de partager le repas quand même avec le voisin qui ne se retrouve pas, qui a perdu son emploi. Et si tu as un peu de riz, tu partages avec le voisin, tu sais qu'il est vraiment affecté, etc. Il y a cette solidarité-là. Donc, mon appel, c'est de se tenir vraiment les coudes et de nous appuyer sur nos ressources locales et d'être à l'écoute des projets qui pourraient être appuyés par les partenaires extérieurs et pour pouvoir saisir ces opportunités-là qui ne vont pas résoudre tous les problèmes, mais qui vont nous permettre de régler un certain nombre de problèmes avec l'appui du gouvernement. Et vous passez par les élus, vous passez par les ONG qui vont faire du plaidoyer pour qu'effectivement le gouvernement puisse savoir qu'effectivement nous sommes dans la détresse et que nous avons besoin d'aide. Voilà.
Parfait. Merci beaucoup, Monsieur Coulibaly.
Merci, merci. C'est une très bonne question. Merci à toi. Merci.
Ok, en tout cas, merci encore, Dr. Coulibaly, pour votre temps. Je pense que nous allons clore notre web chat de ce jour. So thank you everyone for your time, and thank you for all the participants for your questions and anything you could add. We will certainly continue the discussion offline on our Facebook page. We really encourage you to post your questions there as text message, and I'm pretty sure our speaker will be willing to answer them. For now, we going to ask you to stay connected on our social network platforms. We are on Facebook, we are also on Twitter and LinkedIn. We certainly upload this video on YouTube. So on behalf of the American Spaces Côte d'Ivoire Network, I really want to thank you, everyone, for your time. And yeah, that will be all for today, and see you